starting now. The presentation, recording, and any materials presented during today's meeting will be available on the Illinois Workforce Academy website and on the Illinois WorkNet website within 48 hours of today's session. To be as accessible as possible, this webinar will be offering closed captioning, live transcription. Feel free to turn this on using your Zoom toolbar. Tomorrow, each attendee will receive follow-up email, which will include a survey asking you about today's webinar. I will also put the link to that survey in the chat at the end of this webinar. Please provide feedback and any suggestions you have to help improve upcoming professional development efforts. A reminder, if you have a faulty internet connection and would prefer to use your phone, you can do so by calling into this webinar using the phone number in your original registration email. With that, we will go ahead and get started with our presenters. Bethany?
Yes, good morning, everyone, or afternoon, everyone. So we know that today, are you going to do the polls, Tanner, now, or do you want me to announce a couple slides first?
It's whatever you would like to do. I can definitely do the polls if you'd like.
Yeah, let's do the polls, just so we know where everyone's from.
All righty, everyone, let's get these polls going. Okie dokie, looks like we got just about everybody in. Looks like we got lots of Title I today. I'll show you all what we got.
Thank you. Okay, and our second poll is from which local area?
Okie dokie. I'm getting there now. There we go. All righty, second poll should be going for you. I don't know who the last one to participate was, but you just brought Central Illinois ahead. So welcome to all my fellow Central Illinoisans and to everyone else, of course. I will show you all the results. All righty, I will stop this and you can get started whenever you're ready.
Okay, thanks, everyone. I really appreciate you joining this afternoon. I know that it's not the typical time slot for a WIOA webinar, so we appreciate your flexibility there. We also know that you've been waiting for some time for this guidance, particularly if you heard from your customers or from your local elected officials that they want walk-in services, especially if you are in a center that is leased by the state. We understand that every situation is different, and whether that American Job Center is leased by the state or by a nonprofit or owned by a county or any other arrangement you have, we know there's a complexity in making decisions about how to offer services when some partners are in person or some partners are offering services by appointment only. So it's just going to differ for partners in your center. So this guidance is following the recommendations of the Illinois State Police and the Illinois Central Management Services, which oversees the American Job Centers where the state is the leaseholder. And it's also gone through state agency directors and the WIOA interagency team and the partners. We've heard from local partners. All of that has resulted in the memo that was issued today. You also received in April 2022 a draft version of what we've been calling the memo, which is the guidance that we're talking about today. And that draft was issued in April simply so you would have a heads up about what is being discussed at the state level as we studied the issues with the Illinois State Police, Central Management Services, state agency directors, and others. So you've had a view of the draft version for about a month. Today, we're saying we've got some learnings since that draft was first issued. We're going to highlight the differences in the memo that is officially issued today. And even though all of the centers that are leased by the state have some additional considerations for safety in particular, today's memo and the message of today is that the protocol we're discussing today applies to all American Job Centers. And as you think about any changes that you're going to make in your service delivery, if some partners are in person, some partners offers services only by appointment, or some hybrid. So that's the whole point of today, is that what we're talking about today applies to everyone. And you know from the beginning of the pandemic that this has been an evolution. We've all had to adapt as we've gone along. And we started in May 2020 at the beginning of the pandemic, when there was a desire for some guidance about how to talk with your partners about service delivery in a remote environment in particular. And really, we heard the desire for guidance about how to be on the same page. So that guidance was issued in May 2020, just in a checklist format. And there were really only 3 basic requirements, and the rest of it was optional. Now then, fast forward about a year, and we heard again there in June 2021 that there was a desire to think about how can we move forward together in a coordinated way as centers start to reopen, which really meant opening front doors potentially to appointments or maybe to walk-ins. So there needed to be some additional guidance around that. And when we are talking about the notice, we are talking about the notice that is called WIOA Notice 20-NOT-09. That was issued in June 2021. And that is when the first conversation started about a reopening plan. And that reopening plan was required if you were under a certain scenario of a local workforce area, depending on who was your leaseholder or who held the building. And so that was the first time that you did reopening plans, and every WIA has since turned in what is called a reopening plan. Now, flash forward to June 2022, or almost June 2022, and here we are again saying it's time for another adaptation. We know from you that you are looking for additional guidance about how to offer services in person, walk in the front door, especially if some partners are staying by appointment only. How does that work from the customer's point of view and from the staff's point of view if there's this hybrid model? What does that look like, and why is that needed? Well, it's needed because security threats really are real. The other is that there continues to be a high volume of unemployment insurance claims. That is not changed. IDES does plan and has made it clear that they plan to offer their administered programs by appointment only for the foreseeable future. But we also know that there's a desire among other required program partners to offer services on a walk-in basis. So the whole point is that we all need to be on the same page. You all need to be on the same page. You need to understand the state's expectations. You also need to understand how you can obtain the state's agreement to your local plan. So that's what led to what we're calling the memo, which is simply adding additional clarifications and guidance to that original WIOA notice that was issued in June 2021. So in knowing that we needed this additional updated guidance, CMS and the Illinois State Police recommended starting out with a pilot program. which is what the WIOA interagency teams did in partnership with the directors. We opted to start with a pilot of 3 American Job Centers that are seen on the screen, one in Rockford, Pilsen in Cook County, and Champaign. And they were offering a hybrid of walk-in services and by appointment only services administered by IDES. And the thinking was that from the perspective of ensuring safety of both the state agency employees who were housed in those centers, they might experience an influx of walk-in services, as well as the perspective of the customers who just want to walk in the door and get a job or get support without too many hurdles to jump. So trying to find that balance. So we did learn from the 3 pilot sites about how the hybrid model can work. And they were operating under that draft notice, the draft memo, excuse me, that was issued in April 2022. So the same time that those 3 pilot sites started, the draft memo was issued to you all so that you could get a heads up about what was being considered. But it was shared with you with the caveat that we might end up changing it based on the experience of the pilot sites. And that's what's happened for the better. So that's why the final memo includes a general process to help know who's on first base. So there was a question that came up in the 3 pilot sites about clarifying the process of actually drafting and approving the amendment to your original reopening plans from about a year ago. And the reaction to that question was the best practice is that Title I partners at the local level can take the lead in convening the meetings and amending the reopening plan. However, all local partners still must agree to the amendments. There's an expectation that anytime an amendment is completed, it's actually done in collaboration with all of the other partners, as well as the leaseholder and the one-stop operator and the program partners who are physically present in that center. So it's not that different from MOU negotiations. It's not the same thing as MOU negotiations, but think about the way that you engage your partners to make sure everyone really agrees. And if you don't agree, then what alternatives can they bring to the table? So this is the general process based on those learnings and those questions that came up during the pilot sites and the desire to have some sort of suggested process. This is what's on the screen is included in the memo that's being issued today formally. We are suggesting that you treat this like a negotiation. You convene the partners around the proposed parameters. If someone doesn't agree, have them bring an alternative. Then once you get agreement at the local level of all your partners who are physically located there, then you can take it to the state agency directors or their designees to obtain their agreement if needed. And it's needed if state employees are physically present there or in-person UI services are located there, or if it's a state leased building. So once you get that state agency agreement, then you can route it for signatures through the local workforce board chairs and the chief elected officials. Those are the 2 entities that need to sign the reopening plan and the amendment. And after you get those signatures, then you submit it to the same WIOA inbox, which is the same email address that you send your MOUs and your regional and local plans and all the amendments and modifications. So once you submit it to the state at that WIOA inbox, you're good to go, because once you submit it to that WIOA inbox, it means you will have already gotten approval, agreement from all your local partners, already would have gotten agreement from your state partners if applicable, and you already got the signatures to make sure that the LWIB chair and the CEOs are on the same page. So you submit it, you're good to go. The state will take a look at it, but at least you know that you have that agreement and you're good to implement your plan. Then you can communicate it to the field. You really shouldn't communicate it to the field or to your customers until you have gone through these steps. This slide is just a reminder of what happens if you don't agree. This slide is actually a repeat from what we presented last year in June 2021. So it's from the original notice. but it's just a reminder here because it still applies. It's similar to the MOU negotiations. If you look at that bolded font at the bottom of the slide, you use your MOU section 5 to reach agreement. And if you don't agree, then this interagency TA team at the state level can get a remediation team together and start convening you to work out an agreement. So that's very similar to what happens if you don't agree on your MOUs. We're using the same mechanism to help support you getting agreement on your amended reopening plans if needed. If you still can't agree, then the state agency directors or executives might get more involved and say this is the way it's going to be, especially if they're the state-held lease. If the agreement still is not reached after that, then the governor will get involved. No one expects that to happen, but that is the mechanism that's built into the governor's guidelines related to how you negotiate MOUs. The same mechanism applies here. So in addition, those top two learnings were from the pilot sites that we covered, just the general process of how you're going to amend your reopening plans, and then making sure that there's a step in final unanimous approval and agreement of the plan. The other one, the bolded sentence on this slide, says another learning that we had from the pilot sites is that it was just too clunky to try to edit your original reopening plan, either using red line edits or a clean version, whatever it was. It's just easier to create a separate document that you can then attach to your original reopening plan. So if anytime you're going to amend your plan, it's just easier to have a fresh set of questions, answer those, attach it to your original plan and turn it in. That's the key learning. It's just a simple logistical issue that we hope makes your lives just a tiny bit easier. The other learning was about clarifying expectations about who should be the first person the customer sees when they walk in the door. So in talking through best practices and thinking about human-centered design, the best practice is that the security guard really should not be the first person that the customer sees. And there's two primary reasons for this. One is just that walking into a door with an armed security guard as the first person you see might be a deterrent to accessing the services, or might send the wrong message that this person is in trouble or a delinquent because they need services at an American Job Center. That's not the message you want to send. The second primary reason is that the security guard might not know the ins and outs of which services are offered in-person walk-in services versus which services are still require an appointment. It puts the security guard in a place of needing to know the program in and outs. And if that's not possible, then the security guard might not be the best person to have that first contact with the customer when they walk in the door. However, the interagency team and everyone else knows that every center in the state is different. And it's physically different and it's staffed differently. So this memo is acknowledging that if the American Job Center partners agree that a security guard could be the right person for that to be that first person what the customer sees when they walk in the door, then all the partners have to at least agree on that and provide the rationale. And then the state agency director or the designee in charge of overseeing the agreement might have some additional feedback for you about whether that situation will be workable or not. So the default should be that the security guard is not the first person the customer sees when they walk in the door, but it might be acceptable if you can make sure everyone really agrees to it and thinks it through for how those programs will be made clear about which are in-person walk-in versus which are by appointment only. The last learning that we got from the 3 pilot sites is that it might just be best that everyone operates under similar expectations. You all can work this out. It's a local plan. It remains a local plan and a local agreement. However, there are some standards that we think are best applied uniformly across the state because we're really talking about safety and security and health. of both the customers and of the employees in that center. And that those health and safety and this health and safety protocol really should not be limited to a certain type of center. They're just universal. So there, we previously in the July 2021 version of the WIOA notice that's still applicable, it applied these scenarios to which centers fit in certain categories. And it differentiated them between whether the state was a leaseholder or whether a nonprofit was a leaseholder or whether state employees were housed there or not, whether in-person UI services were in that center or not. And it came up with these different scenarios and applied, a process for each of those. What we're saying at this point in the game and this stage of service delivery, those scenarios are not applicable to this particular memo. Everyone should follow those same sets of guidance and procedures for amending your reopening plans. And if anyone needs to know what those scenarios are, they're documented in the original notice that was issued in June 2021, about a year ago. I'm not going to spend time on them now, but there is a rationale if you need it, if you need to know where your center fits in those scenarios for whatever reason. So the question that we also heard from the pilot sites, as well as just in general, is what constitutes a substantive change that would warrant an amendment to your reopening plan that you did maybe within the last 6 months to a year? So we're giving you a couple of examples. One is if your original plan did not say that you were going to offer walk-in services yet, and now a year later, all your partners or some of your partners want to offer walk-in services, that would warrant an amendment to your reopening plan. Although with the exception, we all know IDES has been very clear that their services will continue to be offered by appointment only for the foreseeable future. So the example is that some partners other than IDES want to offer walk-in services when that was not part of your original plan. Another example is that, say your original plan from a year ago didn't touch on group activities like orientations or job fairs or classes. And now you want to offer those in person. Maybe they've been virtual this whole time and now you want to offer them in person. And that would change the traffic into the American Job Center, or that would change the number of people in the center, or that would change the physical orientation of the center, or it would just overall affect the flow in and out of the center. That, we're saying, if it wasn't already agreed upon in your original reopening plan from a year ago, that does warrant another amendment to your reopening plan. So now Mitch is going to walk you through the actual amendment form. There have been some tweaks, and he's going to highlight those from the draft version that was issued in April. So Mitch, would you like to take it from here?
Yep, thanks, Bethany. And as Bethany stated earlier, throughout the pilot process, it was stated that it would be easier if we had just a simplified form of what different questions we had or what aspects need to be responded to. So we came up with this form, and later in the presentation, I'll show you exactly how to access it. It should have been emailed out to all the local areas, but if for some reason you didn't receive it, I'll make sure that you know how to access it. So this is just a screenshot of part of the form, but like Bethany said, what we want to do is take you through the form, highlight some of the differences from the original the plan or the notice, and just kind of explain the why as to the background of why we're asking these questions. Next slide. So similar to the negotiation process of your MOU that Bethany covered earlier, each AJC that is going to be filling out this amendment form should be convening the partners around the reopening of the AJC, and each partner should have a say in the reopening plan, and an agreement should be reached throughout that negotiation process, if you will. So it's especially important that programs that are being offered on site But regardless of if programs are being offered on site or by direct linkage, they should all be a part of that negotiation, with the caveat that a partner that's just offering direct linkage shouldn't necessarily hold up the agreement of the reopening plan because they're not actually physically on site. So again, it should be a good faith effort on everyone's part, hopefully timely, and a negotiation and a good discussion around how to respond to these questions and actually implement the processes that you're discussing. So this is section 3 of the form. It asks for data that was analyzed and assessed for the demand and volume of walk-in customers when the AJC does reopen. So this is very important when state agencies have staff present on site and need to know the anticipated demand and how that compares to pre-pandemic levels. So there's some different data points that you could look at. Obviously, this isn't all-inclusive of everything that's out there, and we also realize that some of this data might not be known. So when you're going through this process and meeting with partners, you want to do your best and look at as many data points as possible to make sure that you have some well-rounded data to ensure that your staffing is in place, your security, all of your protocols, etc. And this also combines with UI claimants who walk in the door but may have to make an appointment. So the form lists these examples, and depending on the data that's available, you just want to make sure that your response to this is thorough and well-rounded. And then section 4 and 5 of the form requests a list of services that are going to be made available to walk-in customers, as well as a plan for handling lines or waiting and the capacity of particular waiting rooms. So it's important to note that there also is a signage template that we sent out. That's also on the e-policy, WIOA e-policy on WorkNet that I'll show you here in a little bit. But that signage can be curtailed for the particular services that are going to be offered on site, and then also the ones that are going to be only by appointment. So it should be posted, right on the front door, but then also in your resource room, any of the waiting lines, so that people understand that if they have to make an appointment, it's possible that they're waiting for nothing if they could just sign up for an appointment and come back later. Then section 6 requests plans for holding in-person orientations and or group events. So now that doors will be opened, you may have space that you'll be offering in-person orientations. So this was included in the draft memo, but the new form template requests that each AJC describe how walk-in events will be handled versus events that will be offered by appointment. So again, you want to state like capacity, limits to the orientation, and just make sure that your responses, spell out each of the steps that you'll take for those orientations and how they'll be handled. And then, as Bethany said earlier, the best practice, don't have that security guard as the first person that a customer sees, because it might deter them from trying to get the services that they actually need. But by all means, we understand that every LWIA across the state is different, or every AJC is different. So if that's the case in your local area, this is where you want to describe it and why. But obviously, if the human-centered design, if we could have a friendly face, at the front door of each AJC, that's obviously what we'd want to do. And then the next slide is the exact same thing, just spelling it out again that, if that situation is that you have to have a security guard up front, by all means, make sure that you spell out the why. And the next section is section 11 of the amendment form, requests information around agreed upon messaging. So I talked about a little bit of the template that we offer. Obviously, all AJCs are different. We offered that template just to get you started. You can use it, you can amend it to your local area, or you could create all new messaging that has a different background, but we offer the UI services phone number, IDES phone number, because those are going to be offered by appointment only. So it's out there. It has examples. I'll show you where to access that. But obviously you're going through negotiations now, so you could always create new signage. You could you just want to give the customer the best feel once they walk into the center, and give them all the resources and knowledge they need before they even talk to a person. In Section 7, it's important for partners to be aware of the reopening plan and that they participate in good faith discussions around the responses and development of the plan. So this last noted section here requests that the reopening plan document those discussions, the date, the method of the communications between the partners, and how they acknowledge the review and approval of the plan itself. So spell it out, give dates, meetings, etc. The more information you provide in response to each one of these sections will really alleviate a lot of any back and forth. We put these questions out there, and as long as you meet each part of the question, there shouldn't necessarily be a back and forth asking for more and more detail if you provide that detail up front. And then, so I did provide a link here, but I'm going to go ahead and share my screen and just walk you through a quick access into the policy. And Tanner, are you able to allow me to share my screen? Perfect.
Yep, just got it.
Thank you. Okay, so this is just, any Illinois WorkNet page that you go to should have a menu option drop down here. And if you go to resources, and this is good to know that the WIOA e-policy manual is out there that takes you into all sorts of WIOA policies, as well as resources, attachments, etc. So if you go into the e-policy, and again, you don't have to memorize this, but if you aren't able to find the policy or the attachments, feel free to email me or our team or any one of the interagency technical assistance teams. We'll make sure that you get a copy of the memo and of that signage. So under Chapter 1 governance, there are a few steps here, so bear with me, but Chapter 1.12, one-stop delivery system under WIOA, and then 12.8, one-stop center technical assistance. And it's just going to be over here on the right-hand side, these notices. So you'll see that there was the general reopening guidance for American Job Centers. Then we have the required form. That's the original form that all the AJCs submitted their reopening plans on. We also have an FAQ. So if there are additional questions that we don't get to today, we will update that FAQ and update this site as well. And then we do have our memo that you received, and then also the signage template. So that memo will also have the new amendment form on it. So you can copy and paste it. You can use it straight off the memo, however you want to do it that best suits your need. Stop share. And
All right, thanks. Thanks, Mitch. And we can be available to answer any questions. Please feel free to enter them in the chat as we go. There's just a couple more reminders we'd offer, and then we'll open it up for responding to questions. But one of the reminders is that the original intent, even back in June 2021, a year ago, was that these reopening plans would be amended as your circumstances changed and as things changed globally. So the requirement to amend the reopening plans is not new. What is new is that there are some additional questions that, based on the learnings from the pilot sites and based on what, state agencies need in order to feel comfortable with their employees and their customers being served as the service delivery model changes. That's what is new with this memo. You always had to amend them in the first place. There's just some new questions that you have to answer and make sure everyone is on the same page before you announce walk-in services are available. So as Mitch said, one reminder is that partners who are making their services accessible through the center, but are only offering them through direct linkage, they really shouldn't hold up the plan, as Mitch said. The other is that not all partners have to return on site or have to offer walk-in services at the same time. The whole purpose of this memo is how to cope and ensure agreement around a hybrid model. And the other is that, yes, think of these plans as organic and think of them as hopefully helpful, not just a headache, but helpful in ensuring you really are all on the same page when partners want to make changes to the way they make their services accessible. And the reason that the guidance initially in June 2021 is a policy notice is because that allows the state to look at compliance, best practices, and provide a helping hand when needed. If partners are not on the same page, then how can we help you? So it is able to be subject to monitoring if there are issues, and if they're just not following the agreement, then that could be a monitoring finding. But if you do the job as suggested, the hope is that you can come to agreement and that won't be a problem. So now what? Now that the memo is issued, you have this additional form to fill out when you do amend your reopening plans, and we suggested a protocol through the memo. Now what? The now what is that go forth, work on those amendments as you need to if your service delivery plans are changing. And again, once you receive that unanimous local agreement, and then if needed, you receive that state agency or designee approval or agreement, and you submit it to the state, or I'm sorry, you get those signatures and you submit it to the state, then you can go forth, as we said earlier. So you really should be able to work on these, and once you reach agreement, implement your plans and communicate those plans clearly to everyone involved. If you haven't already started your amendments, the one thing to consider is that you want to be able to offer yourself flexibility and think through the scenarios of your service delivery. And that includes which customers can access which walk-in services, and those group orientations or job fairs or anything else that is a significant change. Think through those ahead of time, talk through them, and build that into your plan so that all the partners agree that as you're evolving in your service delivery methods, you have thought, you gave it some forethought, and everyone understands that's what's going to happen when you reach that point. So consider giving yourself flexibility, but make them as specific as possible so that you can kind of look ahead of what might come. And then if you need any assistance, the WIOA Interagency Technical Assistance Team is a resource for you, both to support you in the amending of your plan or in reaching agreement if needed. So now we'll pause for some questions. I do see some in the chat, so give me 1 second. I'm going to read through those first, and then I'll see if we can answer them now. And if we can't, then as Mitch said, we continue to update that frequently asked questions, or the FAQ. That will just be circulated so everyone knows the response to the question in writing. So I know we may not be able to answer some center specific questions right now. And I do see a question from Sarah about the security guard is the first person who's visible to the customer when they walk in the door. And that's where the registration desk is. So I think what we're suggesting here, Sarah, is that as long as all of your partners agree that that makes the most sense for your customer to get directed to the right place to access the walk-in services or to make an appointment, and if that security guard is really well informed and all the partners agree to that, including the state agency director or designee of that center, then it could be okay. But you have to go through those steps. You can't just assume that's going to be okay. You have to talk it out. And unanimous approval by partners on site. But just because it requires unanimous approval, I guess how I want to say this is everyone who is in your center is aware of the need to engage all the partners, including IDES. IDES has been part of this from day one in helping think through what their service, their employees, and their service delivery requires to ensure safety. So all I can say is that all the partners who are represented on the interagency technical assistance team, as well as the state agency directors, are behind this memo and behind this best practices. So work with us if needed, but we do think that you can reach agreement if you really answer the questions and talk through them together. I'm not sure if that's going to answer your question, Sarah, but I'm just saying that I think we're all here to try to do the right thing. There's another question of any idea when IDES will open for services, and why are we renegotiating an MOU with pre-COVID operations? Okay, so there's a two-part question there. We cannot say when IDES will reopen for services. Our understanding is that they will, they're going to remain by appointment only for the foreseeable future. Would anyone from IDES like to add to that? Okay. The second question is, why are we renegotiating an MOU with pre-COVID operations? I don't think that's the case. I think that's a misperception. We're not renegotiating MOUs. You're dealing with your MOUs that span 3 years, and you amend them annually in order to account for any changes in the budget or significant service delivery. But those are specific to service delivery and compliance to the governor's guidelines around how you're going to share costs and deliver services. These reopening plans are more about ensuring safety and agreement when things have to change really quickly to circumstances, either from COVID or from safety, public safety protocol or public threats. So these reopening plans are trying to help you think through and be prepared for the unexpected, so that you don't have to amend your MOU every single time a circumstance changes for something that's out of your control. You're trying to be prepared for those health and safety risks that can occur at any time. Those are kind of outside of the MOU on purpose, because we hope the MOU will have a longer lifespan than this reopening plan. And pre-COVID operations, these are not pre-COVID operations. The only pre-COVID context here is that it's helpful to think through what was your demand for services and the flow through the center before the pandemic, because we know it decreased during the pandemic because doors were closed. So now, as you're thinking about offering walk-in services, is it going to be back to what it was before, or is it going to be a little more because now there's a pent-up demand? If you think through that based on the data that you have readily available, and you talk about it with your partners about what they think might be the demand for their services, that all allows you to think through, do we have the capacity to do this with the staffing that we have? Or do we need to make some changes? Or do we need to put in some additional protections if there's going to be lines out the door for services when the door opens? It's just helpful to think through the demand pre-pandemic and now. It's not going back. We're not reverting to pre-COVID operations. Another question is there an agreed upon timeline for reopening the remaining American Job Centers? So this is really a local decision that if you and all of your partners in that center want to explore offering walk-in services when you haven't been recently, then that's when you initiate the process and let it take its course. There's no required timeline or deadline for you to turn in an amendment to your reopening plan. The only requirement is that you go through the steps before you announce walk-in services are available, and going through the steps to make sure there's agreement before that's announced. So the hope, though, I think, the common hope, I would say, is that centers would be working towards a reopening for the new program year, which starts July 1. It's not a deadline. It's not a requirement. It's just kind of a hope that in the new year, you can have these protocol in place so you're all on the same page for the new year. Can this reopening plan be utilized to also agree on COVID-19 protocols, such as communicating positive cases to partners and sanitizing logistics at the AJC? Yes. Robert, your question does relate to a checklist that was the original May 2020 version. So 2 years ago, there was a checklist that was developed as a guidance, not required, but said that aligned with the governor's Restore Illinois plan, which was primarily at the time focused on public health due to safety COVID protocol. So if you are looking for specific examples of how to talk to your partners about COVID-19 protocol, that checklist issued in May 2020 could still be a resource for you. It's still applicable and it still aligns with the governor's 5 phases. So if we were to revert back to a former phase of the Restore Illinois plan, that document still really does exist and does have a lot of resources for the health protocol and offers metrics for you to talk to your partners about. So you can address it in this reopening plan, yes. And there are resources to help you do that. And if you would like us to point you to those, either contact us or go to the WIOA implementation portal that Mitch showed you earlier. That's where a lot of COVID-19 resources are related to those very questions. You're welcome, Robert. Okay. There's a question in here. I'll read it. I'm not sure we'll be able to answer it online here, but we'll read it so everyone, in case anyone who's not seeing it on their screen. It says in LWIA 7, which is Cook County, you've heard from IDES staff that the leadership of that agency told them they cannot reopen until July or early August. And, you know, I know it sounds like there's some surprise that you want to talk about reopening other centers. We know from IDES and the WIOA interagency team, as well as the director level conversations, that there's no set date, that services will be continued to be offered by appointment only for the foreseeable future. And we don't know what date that is. Our understanding, though, is that that does not prevent you from updating or amending your reopening plans to come up with some kind of agreement of how that can work, even if IDES remains by appointment only. Is there a way that other partners can make their services accessible, either through walk-ins or other ways? That's part of the conversation. That's why we're going through this process. Does anyone from IDES want to chime in here on this response?
Yeah, Bethany, this is Janice. I think it's Kit who asked that question, and please feel free to reach out to Stacy and I. We can have a separate conversation to discuss the specifics of the note you put on the chat.
Thanks, Janice. I appreciate that.
I would just add that that's the note here. That's not consistent with, I don't know, anything. So hopefully that's just some type of rumor and we can kind of work together, like Janice said, to put those concerns to rest.
And although, you know, we talk about these requirements, and I know it can feel like there's just requirements piling on top of requirements, but let's be honest, the entire purpose of these reopening forms is to ensure that you talk to each other. So we're hopeful that it just gives you the conversation guide to make that happen. Okay. I am not seeing any other questions. I'm going to pause and just see if anyone else wants to add any additional questions to the chat. Okay. We are here as a resource. You can go with your agency contact, please do, or your interagency TA team member with whom you interact with for your programs. Or if it's easier, you can contact me or Mitch and we'll link you to the right people, or we'll get a response on behalf of the TA team, or route something up to directors through the TA team if needed. So please just know that we really are all in the same boat, and we want to support you in any way we can so that you can have predictability in your services. So thank you for attending today. Feel free to contact us anytime as you consider your reopening plans and amendments. I think that's all we have for today.
Alrighty, everyone. Thank you for attending today's webinar. As I stated earlier, I have put the follow-up survey in the chat if you would like to take some time immediately preceding the webinar to provide feedback and any suggestions to help improve upcoming webinars. That same survey, along with the link for the presentation materials and the recording, will be located in tomorrow's follow-up email as well. Thank you so much and enjoy the rest of your workday.
Thanks, everyone.